Hello friends, today we are discussing about some instrument used in the general medicine. First of all, we have endotracheal tube. It's connected to the ventilator machines. Indication for use is number 1, any kind of respiratory failure. Number 2, to induce general anesthesia. Number 3, any other disease which indirectly involve the lungs like musculoskeletal problem. Contraindications: we cannot use endotracheal tube in the spinal injury or any growth or tumor in the trachea. Precautions: wear sterilized gloves, do not hurt the patients. Number 2, we have two Way Foleys catheters with bag. Indication of use is number 1, urinary retention secondary to any cause like prostate enlargement and stones. Number 2, comatose patient. Number 3, post-operative patients. Contraindication: number 1, we have urethral strictures. We cannot use these instruments in urethral strictures, pelvic trauma, any bleeding disorders. And then we have spinal needles, also known as lumbar puncture needles, given at the level of L3 and L4. Indication for use is number 1, suspected cases of meningitis, syphilitis, diagnostic purpose. Number 2, spinal anesthesia, therapeutic purpose. Number 3, to give chemotherapeutic agents, brain tumors. Number 4, to take fluid out in the hydrocephalus to decrease pressures. Contraindications: number 1, the patient refuse. Number 3, skin infection, any scar or any skin infections. Number 3, rise intracranial pressures due to the tumor or space occupying lesions in the brain. Number 4, any bleeding disorders. Insulin syringe. Indication for use is for inducing vitamin K. Number 2, for inducing insulins. We have 4 types of insulins. We have rapid, short, intermediate and long-acting insulins. In rapid-acting, we have aspart, glulysin, lispro. In short-acting, we have regular insulin. In intermediate-acting, we have NPH. And long-acting, we have determinants and glargines. Number 3, to give any subcutaneous injections. Contraindication is bleeding disorders. Number 2, local infections. Complication of using insulin syringe is lipodystrophy. Nasogastric tube with feeding syringe. Indication is number 1, for feeding purpose in comatose patient. Number 2, feeding in patient with absent gag reflex due to stroke. Number 3, for gastric lavage poisoning. Number 4, intestinal obstruction. Contraindication: number 1, gastric erosion. Number 2, maxillofacial surgery trauma. Number 3, bleaching poisoning. Number 4, corrosive poisoning. Because we induce the pipe, it's very harmful. We have IV cannula. Indication for use is number 1, to give fluids. Number 2, blood transfusions, bleeding patients. Number 3, IV medications. Contraindication is number 1, avoid at side of the joint. Number 2, local infections. Complication of IV cannula can be thrombophlebitis. Preventions: number 1, avoid air bubbles. Number 2, avoid air bubbles which cause air embolisms. Number 2, do not hurt the patients. Number 3, avoid double puncture. And we have Girdle's airway. Indication for use is number 1, to clear airway. Number 2, to clear secretion, suctioning purpose. Number 3, avoid falling back of tongue in any surgery, etc. Number 4, to avoid tube blockage in semi-comatose patients. Contraindications: number 1, tooth dislodgement. Number 2, local trauma. And we have IV syringe. Indication for use is number 1, blood sampling. Number 2, IV medications. Number 3, IV fluids. Contraindication is number 1, local infection, chances is very high. Number 2, avoid injuries, which can be double punctures of the arteries or veins. Number 3, avoid vein that cross over joint. Number 4, IV access should be attempted as distal as possible. Thank you very much.